There's another hepatitis A scare, and this time it has to do with ahi cubes used to make poke. The health department announced this afternoon the tainted product was sold at multiple Times supermarkets and Shima's stores across Oahu, and people may have been exposed to it this past weekend. Bridget Namata joins us with more. Bridget?
Joe, once we learned of yet another hepatitis A scare, we went straight to the health department for answers. The sanitation branch tells us that this case of hepatitis A differs from last year's outbreak because the source of the tainted fish was discovered quickly through the local distributor's routine product testing. Frozen raw tuna, or ahi cubes, imported from Indonesia, sold April 27th through May 1st, tested positive for hepatitis A. The frozen fish was used to prepare poke at the following Times supermarkets and Shimas: Aiea, Kailua, Kaneohe, Kunia, Liliha, Mililani, Waipahu, and Waimanalo. Times immediately shut down its seafood departments once it found out.
We disposed of all of the product, whether it was the potentially affected or, well, we actually disposed of all of the product that was in our seafood department that was physically processed within the store, and then we did a complete sanitation of our entire department as a precautionary measure.
The health department says the frozen ahi cubes were also used at GP Hawaiian Food Catering, the Crab Shack Kapolei, Aloha Sushi at North Nimitz, and the ABC store at 205 Lure Street. The health department tells me Tropic Fish, the local distributor, discovered 200 tainted cases of frozen ahi cubes. Each case was 15 pounds a case. I learned 140 cases were recovered and never got sold. In a statement, Tropic Fish Hawaii's president says, "Our normal procedure is to receive the test results prior to distribution, but unfortunately that did not happen with this particular shipment. We have corrected our procedures to ensure this will not happen again. I want to personally apologize to our customers and the public." The health department credits Tropic Fish Hawaii for conducting its own quality control testing and for informing health officials and its customers as soon as the tainted fish was discovered.
It was self-reported, so that's the big thing. Industry already had some mechanism in place where they've actually segregated lots of their shipments that they get in from Indonesia.
The health department says hepatitis A is always a risk when consuming raw foods.
So we, again, the main message to people is we require consumer advisories in all these food establishments that still warn you if you're going to insist on eating foods raw or undercooked, then you are at a greater risk for contracting foodborne illnesses.
The health department says so far it has not heard of any cases of hepatitis A, but healthcare providers have been notified and will be tracking as we go on. Reporting live at the health department, Bridget Namata, KHON 2 News.
It was last August when the health department identified raw scallops served at Genki sushi restaurants as the source of last year's hepatitis A outbreak. Seaport imported the tainted product from the Philippines. It was distributed by Koha Foods. A total of 292 people got sick. The outbreak was considered over in January. Since hepatitis A has a long incubation period, health officials are urging people to get vaccinated. Many got the vaccine after the last Hep A outbreak, but remember, you need 2 doses 6 months apart. Children are routinely vaccinated between their first and second birthdays. Always Investigating has been keeping tabs on food safety flaws with imported seafood since the hepatitis A outbreak last year. We checked today and found tainted Indonesian seafood imports were busted by FDA inspectors nearly 60 times already this year. Import refusal data from the federal agency reveals hundreds of catches like this every year, with unsafe tuna accounting for the vast majority of rejected shipments. But only about 2% of all foreign seafood is inspected by the U.S. Food and Drug Administration before it hits stores and restaurants. And of that 2%, just a fraction gets turned away. And we'll be asking more questions about how this happened again and what's being done to keep our food safe as part of our continuing coverage of this latest hepatitis A scare.